a real privilege to introduce our next guest from the UNM Cancer Center. He is the Chief of Plastic and Reconstructive Surgery at UNM Cancer Center. Dr. Christopher Demas is joining us here at the big round table. Dr. Demas, welcome.
Thank you.
To the Morning Brew.
It's great to be here.
Good to have you.
Thank you for being here.
No problem.
We enjoy having doctors from UNM Cancer and
We
UNM
do.
Hospital because you guys are just awesome.
So you're kind of new to town. You're newly
Yes.
hired. You started in July.
Yes, I did.
And well, first of all, welcome to the community.
Thank you.
And what's your impression so far of where you work and our town?
Both great. I love the medical center. I think it's full of great people, a lot of great talent, and a great mission. It's a great safety net hospital. It's a real privilege to work there. And the town itself, I mean, I can't be happier. I lived in the Southwest a number of years ago and was really just very happy to get back. And this is, I think, a great environment. It's great weather. It's great, great opportunities for outdoor lifestyle, and it's fun.
Well, we love it, and we're happy to have you.
Thank you.
Now, you've been in the field 30 years?
I've been in practice about 25 years. Yeah.
So tell us a little bit about your history. We were just having a little conversation off air. You were just in New York, so you're from New York, or what?
Actually, I was born in New York, and I grew up in just outside New York City. Most recently, I was the chief of plastic surgery at Staten Island University Hospital for 3 years, and kind of didn't love New York as much as I thought we would. So my wife and I said, let's get back to the Southwest, and here we are.
Your specialty is breast reconstruction after cancer treatment.
That's probably the majority of my practice right now. Yeah.
And that work and that research, of course, is going to take place at the UNM Cancer Center. Have you met a lot of your colleagues? And
Yes.
Pretty talented bunch. We've had several people through here that do research and work over there. Give us an idea of some of the advances in this area of medicine.
Well, obviously, in breast cancer alone, just in the treatment of it, in the chemotherapy, in the radiation treatment, and finding ways to deal with it surgically, there's been a lot of advances. So I mean, I think survival is so much better now, and the quality of survival is so much better now. So I think there's just so many untold advances. From my field, we've had a number of newer things that we can offer patients, a lot more patient-friendly treatments.
How many people probably do treat on average in a month? It's a lot of...
Well, I see probably 5 or 6 new breast cancer patients a week, and when I see them and I examine them and talk to them about their options, it's a very lengthy visit. It takes over an hour just for the first visit. I usually see these patients at least twice prior to any surgery.
How much of a role as a counselor do you feel that you have in these sessions?
Well, fortunately, by the time they've gotten to see me, they've had a lot of counseling. They've had a lot of opportunity. But yes, certainly, I'm
It's
part
traumatic.
of it. Yeah, it's a difficult time for them.
So, New Mexico, we have UNM, and we have so many new technologies coming forth now. Can you tell us any new things that we can expect from UNM?
Well, from my perspective, I mean, the things that I'm offering that are kind of new to UNM is I'm offering a microsurgical way of doing breast reconstruction, which is a very specific way of transplanting tissue from one part of the body to the other, and it's been very, very low morbidity for the patient, meaning I don't have to do a lot of muscle damage to transfer this tissue. That's something that has not been offered at UNM up until this point. The other thing that I'm really excited about is a way to do breast reconstruction without any major surgery, just using fat grafting.
Oh,
and
wow.
that's really the coolest new thing.
We've obviously heard this in the media through celebrities who have chosen this path, but there are women who have a tendency for breast cancer in their family genetically, and have gone ahead and elected to have a double mastectomy. Are you seeing more of that happen?
Great question. Yes, that is definitely on the rise, and currently I think nationwide or about 12% of women choose that option, and those are patients who have, they have the gene. Even some without the gene choose to go that route.
The gene is identified then.
Yeah.
And I've been seeing a lot of other things in the news lately. The age keeps changing as far as like women getting scans, breast scans, and that keeps either going up or going down. And I don't know, I mean, I'm sure politics is behind that because of costs, but I mean, what is a really good age to start doing that?
That's a tough question. That's something that experts in that aspect of medicine can't even agree upon. But I would certainly think if you have a family history, earlier is better. If you don't have a family history, you probably don't really need something until you're 40, 45, 50, somewhere in that range.
So is that like the average age then of people actually getting breast cancer?
You have some patients who get it very young, but the majority of people are much older when they get it still.
I've heard that men can have breast cancer too.
Yes.
Have you treated some of that?
No, I have not. I have not. No. It's not that common.
But it does happen.
Absolutely.
No.
Yeah.
When you're talking to a patient about reconstruction, how many options are there? Dozens, or are we down to 2 or 3?
That's the problem. And when I sit down with a patient and I actually show them, I have a PowerPoint presentation that I present to them. There are so many options. It's overwhelming.
Oh, really?
There are over a dozen, and you have to really specifically set it to each patient because what's good for one patient may not be good for the other. And so, and even in some patients, there aren't that many options. So you're down to just a couple of things.
So it just depends how bad it is.
Depends on it depends on lots of things. It depends on what they want. It depends on whether they want to use implants, whether they want to use their own tissue, whether they want to have a long recovery, short recovery, whether they're overweight, whether they're thin, whether they have other underlying medical problems.
When you're consulting with a patient like that and you've shown them the PowerPoint, do you give them time to decide? Do they have time?
They don't make that decision then. It's very rare. And I almost always, not almost always, I do always say, I really want you to come back. Think about it, read the printed material that we give you, think about it and come back.
So what should people consider then when seeking treatment and possible surgical reconstructive surgery?
Well, what are their, in terms of their options, or what should they expect, or?
Yeah, I mean, well, of course, UNM's like the place to go, but
we'd like to think that.
Yeah.
Would that be your first things? Like, well, if you have it, come to cancer hospital first.
I think if you want the most comprehensive treatment from the greatest number of skilled people, I think that's where you're going to find it at the UNM Cancer Center.
Breast cancer itself, is it a fast-growing cancer? Is it something that time is of the essence, or are there variations of that?
There are variations. First of all, that's the problem with cancer. It's not one disease. There's many, many different diseases.
Cancer is too broad a term for...
Yeah, I mean, even with the breast, you have multiple different kinds of breast cancers. So it's really difficult.
Some do advance more rapidly than others.
Absolutely.
And that could be like genetics.
It can be genetics. It could be age. It could be, let's say, if you're pregnant if you have breast cancer when you're pregnant, that can be a really bad time. Because the estrogen levels and things can be really can get out of hand quickly.
Have you had any patients that you've had that?
Yes, unfortunately. It's a real devastating thing for them. Extremely devastating.
When you follow up with patients after a period of time and cancer is under control or maybe in remission, personally, what does that do for you as a physician?
It's extremely rewarding taking care of these patients because the difference you can make in their lives, and it's something that's just, they're some of my greatest patients, and it just makes me feel so good.
And do you see a lot of patients come from out of state as well?
Well, I haven't been here long enough to tell you that. Certainly, we see patients from all over this state, and I imagine we'll see patients from eastern Arizona and southern Colorado and things like that. Yeah.
Well, it is wonderful to meet you. I'm very glad to have you come down. Obviously, we're just down from your office. Come by and have a cup of coffee with us anytime.
Well, thank you.
It's amazing what you do, so thank you.
It really is, and we're glad to have you as part of the community, too.
It's great to be here.